Namaste and welcome everyone. My name is Kavita. People who joined yesterday might recognize me. Uh, so, thank you for joining us again today, and also welcome to everyone who has joined the session for the first time. We are continue to celebrate Women's Day. So Sewa Europe marks Women's Day in 2024 with respect and gratitude to all women by celebrating womanhood with you. This is a series of three webinars, which is focusing mainly on women's health and wellness. We had one session, one webinar yesterday, 8th March, and it was the main focus was Yog Dance, and the topic covered was weight management. Hope it was helpful and informative for those who joined. And today, 9th March, we will be covering the topics menstruation cycle, PCOS and PCOD, along with it weight management. And then tomorrow, 10th March, from 10 to 11:30 a.m. CET, the topics are menopause, thyroid, mental and physical challenges during pregnancy, pre and postnatal. So the same webinar joining link will work for all the sessions, also for tomorrow's session. So I would like to tell a few lines about Sewa Europe. Sewa International Europe, it's commonly known as Sewa Europe. It's a premier charity non-profit humanitarian organization based on the dharmic, that is righteous values, an organization that serves selflessly with compassion to create a positive impact with focus on the well-being of the society. Sewa Europe is driven by mantras of Vasudhaiva Kutumbakam, which means the whole world is one family, and Seva Paramo Dharma, which means selfless service is one's supreme duty. The main works that Seva Europe does is in parts of disaster relief, rehabilitation management, education, and skill building across various parts of the world. With registered offices in Finland and Germany, Sewa Europe has a strong volunteer base from all walks of life, such as doctors, engineers, techies, entrepreneurs, and so many others. So they are all driven by the intent to serve the humanity selflessly. Sewa Europe proudly takes refuge under the global umbrella of Sewa International. This is a few lines about Sewa Europe. Now I would hand over it to you, Mitali ji, for the next part of the discussion.
Thank you, Kavita ji, and namaste to all who have joined in today, and happy Women's Day to all of you. So, with serving society through the yogic perspective to spread the health and the well-being is one of the major initiatives of Seva Europe. We organize various activities both virtually and physically based on yogic knowledge and practice to help everybody. Okay, even in the mental and in the psychological well-being. You can follow us through various channels, also through our website, sevaeurope.org, or through the various channels. So before any further ado, we'll like to start our session today. But before we start, I'll just give, you know, some rules and regulations before starting our session today. So, if you have any questions which will be on the topics which we handle today, please put it in the chat box so we can go through it at the end of the session and we can come back to you. In case if the questions are not being answered, then we request you to please send also the question on info@sevaeurope.org, so we can then try to our best to give you the answers through the email as well, and of course through our experts. And if for today's session, if you choose to follow the yoga with us, which is shown or which is demonstrated by our experts, please make sure you don't have any previous physical conditions which are restricting you to do it. Okay. So without any expert advice, please don't do anything which you're not able to do it. So today what we will present to you will be just in general and not specific to any of, your physical or your mental problems. So please be sure of that. So Seva Europe or none of us even holds, any responsibility if anything happens to you there. So before any further now, again, I would like to introduce our today's guest speaker, who is Dr. Mrunal Jamdadeji. So she is an MD. She's BAMS, she's MD, and she's a PhD with the specialization in preventive social medicine in yoga. Her expertise is augmented by her mother, Mrs. Kamala Nanavre. She is a distinguished yoga teacher with over 25 years of experience. Dr. Jamdadeji, she's been serving as an Ayurveda and yoga expert consultant for the past decade. She's contributed in the field through publishing her research articles in the therapeutic aspects in yoga and an index journal. She's also been invited as a guest speaker in various webinars, and she also teaches in a medical college, and she was also invited by the Ayurvedic Vyaspeeth Pune. So I would please request now Mrunalji.
Thank you,
Namaste.
Mitali. Namaste. Thank you, Mitali ji. Hello, everyone. Very good morning, and I wish all of you a very happy Women's Day. It's International Women's Day, so uh, we are having a special gift as a woman that is differentiating us from what we can say male partners. And today's topic is exclusively related to this only, that is menstrual cycle, PCOD, PCOS, and weight management related to it. So I'm going to start my presentation here. So we are going to see few points or few theoretical points before starting any practical session. So we are going to start our today's topic. Today's topic is yoga therapy in PCOD, PCOS, and weight management. And my so what are we going to in are we going to see in today's session is what is PCOD and what is PCOS, their sign and symptoms, clinical management, general clinical management, role of yoga and importance of yoga in it, and last part is therapy. In the part is the practical part of the PCOD and PCOS yoga therapy. So, what is PCOD and what is PCOS? Polycystic ovary disease and polycystic ovarian syndrome are their full forms. So, we can see here syndrome, that is a collection of the disease or disorder. So it is very tricky to treat polycystic ovarian syndrome. On the other hand, polycystic ovarian disease is reversible, easy to treat, and today the polycystic ovarian disease is increasing day by day. Around 10% of the total population is having the polycystic ovarian disease. Its prevalence is very much, and there are many reasons behind it. Lifestyle modifications, we can say the food we are eating, the lifestyle we are living, and etc. etc. But the thing is, the continuous menstrual cycle, the normal menstrual cycle gets disturbed, and because of the hormonal imbalances, and which results in many signs and symptoms which are leading to polycystic ovarian syndrome. The syndrome is the collection of the disease or different types of disorders, and it is very uncommon. But when it occurs, it's really hard to treat or very tricky to treat the polycystic ovarian syndrome, and it is irreversible. Sometimes it is not curable, and which results to the infertility, also the miscarriages and all. So in this slide, I just want to give you the idea about what is ovarian disease or cystic ovarian diseases. So polycystic ovarian diseases are mainly seen in reproductive age of group, but in this case, the conditions are reversible with the help of proper treatment, diet management, and lifestyle modifications. And chances of infertility are less. It may occur after the pregnancy also. On the other hand, in syndrome or PCOS condition, the conditions are very severe. In this, male hormones are secreting in the feminine body, and it gets deposited. Ovarian cysts are not seen in this type of condition, but sometimes may be seen, and which collectively lead to the miscarriage, infertility, and etc. And as I stated earlier, it is quietly irreversible condition. So it is the general idea. This is the general idea. In this slide, I have shown you how the picture of PCOD and PCOS is seen. Physical and psychological changes are seen. So we collectively say that psychosomatic disorder or psychosomatic changes are seen in the person related to their psychological health and related to their physical health. Ovarian cyst obviously seen during the investigations, sonography and all. We can see the ovarian cyst. Next part is the obesity. Next part is excessive body hair growth because of the less amount of feminine hormone. Next part is trouble in conceiving, depression, acne, fatigue, irregular periods, thinning of hair, and low sex drive. We can see that all these symptoms are related to our feminine hormone, that is estrogen hormone. I have started during the webinar that what is making female or what is making female differentiate from the male is the basic hormone is the estrogen hormone. So when it gets disturbed, the changes in the uterine and ovary are seen, which are resulted to the PCOD and PCOS. So this is the general idea. These symptoms may be less or more. These are related to the patient to patient. It is not like that all the signs and symptoms are seen in every patient, but most of the patients are giving this picture of PCOD and PCOS. So what are the line of treatment in it? So there are many line of treatment: Ayurveda, allopathy, homeopathy, Siddha, Unani, and now yoga. Naturopathy also are having promising result in case of PCOD and PCOS. Basically, it is a hormonal balancing or making the equilibrium between the hormonal functioning and ultimately treating the disease. So what we are seeing here, why yoga therapy? Why we are looking towards yoga as a therapy for the PCOD? So as we have seen, the disease is related to our hormonal imbalance only. So hormonal imbalance, according to yoga, body equilibrium is related to our three nadis, that is Ida, Pingla, and Sushumna. Ida nadi governs or controls our left side of the body. Pingla nadi controls our right side of the body, and the 72 thousands of nadis are controlled by the one nadi, that is the Sushumna nadi. So the Nadi Shodhanam Kriya is very important when we are seeing or we are when we are looking for the hormonal imbalance therapy. Nadi Shodhanam or body purification, which is occurring from inside in the yoga, which is helpful for treating the PCOD and PCOS changes. As we have seen, there are psychological and physical changes. That is psychosomatic changes. So not only we not only the physical part but also the psychological part that we have to cure in the disease. So in yoga, both the balancing body and mind balancing along with the hormonal balancing are helpful to treat the disease. So first part is the Nadi Shodhanam. Nadi Shodhanam, right side nostril, left side nostril, Nadi Shodhanam Kriya, which helps to the maintaining the equilibrium in our body. For that, Anulam Vilam Pranayam is given. Next part is body purification from inside. In yoga therapy, six body purification techniques are there. That is Nauti, Neti, Vasti, Nauli, Trataka Kriya, are all helpful to purify our body. Next part is Sapta Chakra and nerve plexuses. For this, I want to show you the image. In this image, we can see the chakra sthana, Muladhar, Swadhishthan, Anahata, Manipura, Muladhar, Swadhishthan, Manipur, Anahata chakra are basically the nerve plexuses which are situated at that the region. Again, in the upper body, Vishuddha chakra, Ajna chakra, and Sahasradhar chakra, which is also called as a Brahmarandra chakra, are also the composition of the nerve plexuses which are placed in our body. So anatomically, these are the plexuses, nerve plexuses, which are given as a chakra name in yoga therapy. So when we do pranayam, when we do yogasan or any kind of a yoga therapy, so all these chakra get activated, which are helpful in treating the hormonal imbalance in our body. Next part, restore hormonal imbalance. The part which I have explained, easy and cost effective technique. You are not going to spend money or anything for doing the yoga. And last part is most important part. Many clinical researches are published on the yoga therapy aspect in PCOD and PCOS, and they from that research data, uh, there are many positive and promising changes appeared after the practices of yoga. But the patient or the participant should practice the yoga or yoga therapy for few weeks, for few days. This is not like that you are doing yoga for a day and you are seeing the result. It's not like that. Yes, you see the positive effect, positive psychological changes in your mind, but for physical changes you have to wait for few days or few weeks. Before starting the therapeutic part or before starting the practical part, these are the do's and don'ts for the yoga. Teacher guidance is very important. If you are doing yoga right now with me, then also I am suggesting you, if you are familiar with the yoga posture, if you are doing the yoga regularly, then you can do that. But if you are not doing anything, any exercise before, then just observe the session, and after that you can practice under the guidance of teachers only. You should wear the comfortable clothes. You should sit comfortably. Yoga mat is compulsory for the support purposes. Also, before practicing, bladder and bowels should be empty. Uh, if you take any light lunch or a light breakfast, then you should have wait for the 45 minutes, and after that you can start with the warm up or the loosening exercises. Then the place where you are practicing, the place is should be very air ventilated. Now, don't part. The first part is given, or the first point is I have mentioned is women should refrain from irregular practices, especially asanas during their menses. See, during menstrual cycle, the apana vayu, according to Ayurveda and yoga, the apana vayu is activated, and that is why we see the blood flow from the vagina. In this time, when we practice certain types of yogasana that restrict the flow of blood, which result in accumulation of impure blood in the uterus. In short, we can say the impure blood is accumulated in our body, which gives rise to blood related or the disorder which are related to the Rakta Dhatu. So, women should not practice certain asanas, but women having the menstrual issues, amenorrhea, less blood amount, or we can say the spotting only seen in the regular menses, then only they should practice certain type of asanas that help to produce or that help to extract the impure blood from the body, which is essential. So this part is very important. Sometimes it is said that in menstrual cycle you should not perform asanas, but in PCOD and PCOS cases, the amenorrhea, if amenorrhea symptom is there, scanty bleeding is there, spotting is there, then you should perform certain types of asana which help to extract the accumulated blood in the uterus from the body. Now, next part is don't perform yoga immediately after the meals, which I have stated earlier. Yoga should not be performed in a state of exhaustion, illness, and in a hurry, uh, and in stress condition, which lead to the psychological imbalancing, and it is very harmful as our mind and our body are connected. So mind health is depend on our body, and body health is also depend on our mind. But we know that our mind control or mind health is very important for our body equilibrium or hormonal equilibrium. So these are the do's and don'ts before practicing any type of yoga posture, pranayama, and etc. Now next part is actual the practical part, that is asanas or yoga posture for the PCOS and PCOD. So the picture of the PCOS and PCOD, general picture of the PCOS and PCOD we have seen earlier in the slide. As I have stated earlier, the patient to patient picture may vary. Some may show the amenorrhea symptoms, some may show the menorrhagic symptoms. Some are having back pain or a leg pain, but some might be not having that type of pain. So it is depends on the condition or the picture of the patient, and accordingly yoga postures are suggested. These are the postures. Now, Paschimottanasana, Ardha Mundukasan, Janushirasan, and Ugrasan, Malasan, Utkatasana are the sitting postures, and remaining postures are the lying down postures. So we will start the practical part now, and session in this session I'm going to show the postures for few seconds only because of the time limitations. But for uh, daily practices, you should perform at least 15 to 20 seconds. Hold the posture for 15 to 20 seconds, and when you get habitual, then you should increase the time of the asana holding. As we have already seen do's and don'ts of yoga, and I request accordingly you should practice the asanas. Okay, so first part is a Paschimottanasana. This is a sitting posture asana. So first you have to sit like this. Your legs should be straight. Your hand should be at your thighs. Your back should be straight. Inhale and lift your both hands. Exhale and bend forward, looking towards front side wall or window. Hold the legs. Again inhale and again exhale. With exhalation, you have to bend towards your knee joint. You have to touch your forehead towards the knee joint. Then again inhale, exhale, breathe in and breathe out and hands down. This is Paschimottanasana, and it is a prime asana when we see when we want to treat PCOD condition. Okay, these asana should be performed in amenorrhea conditions during menorrhagic, that is where blood bleeding is more than the normal bleeding. The asana should not be performed during the menstrual cycles, but where bleeding is very less, scanty, in that time during menstrual cycle also you can perform the asana. Now next part is the Ardha Machendrasana. For the Ardha Machendrasana,
Mrunalji, sorry, just a minute. I would again like to just tell everybody if you're performing the asanas with Dr. Mrunalji, then I would please request make sure you don't have any physical conditions before which you're restricting to do asanas with Mrunalji.
yes, thank you, Mitali ma'am. And Mitali ma'am is correct that if you are having any physical problem or if you are having any injury history before, then you should perform very carefully. Or I request you just observe the asanas, listen to the information, and after under the teacher guidance, you should perform the asana. So next is the Ardha Matsyendrasana. So for this, hold one leg, other leg should be like this, and your one hand on the thighs of the this leg, and the other hand should be like this. So for this, your hands on the waist like this, and you have to look back. If you don't want to fold hand like this, you can just put your hand near your back and rest. This is Ardha Machendrasana, and relax. You can perform this asana changing your legs also. This is a twisting type of posture and which helps to twist the uterine muscles and helps in PCOD conditions. Next asana is the Mandukasana. Mandukasana is a stretching type of asana in which we firstly we have to sit in Vajrasana, that is fold your leg like this. After Vajrasana, we have to sit between your thighs like this. This is a Mandukasana. Hold the position as per your capacity, and after that, if it is comfortable for you, then bend forward. Okay, if it is not comfortable for you, then you can sit in this posture also, no problem. So this is a stretching type of asana. In this asana, we are not going to do any twisting. So how we are going to bend? Just breathe in nicely, breathe out, and bend forward, forehead towards wall, and slowly breathe in again and breathe out. How you are going to come out from the posture? Then first again sit in the Vajrasana and slowly stretch your legs and relax. Now next part is the Janushirasana, in which one leg should be folded and one should be straight. Now this is a twisting type of posture in which one hand should be below of the other legs. Hold the other leg with your hand. You have to hold toe and look upward. That is the Janu Shirasana. It is again the twisting type of asana. In Janu Shirasana, back muscles also get stretched and uterine muscles also get stretched, which collectively helpful in the treatment of the PCOD. Next part is the Ugrasana. So
Mrunalji,
for
uh,
yes,
is it possible to stop the sharing now and so that they can see your asanas clearly?
okay. So for next part, I will start presentation again. Okay.
Yes.
Okay. So next part is Ugrasana. For Ugrasana, you have to sit in by stretching the both legs as per your capacity. You have to take distance between the legs as per your capacity, which will stretch your whole thighs and whole legs muscles. Calf muscles, thighs muscles are get stretched. After that, you have to bend between your legs. For that, lift your hands or arms with breathe in, breathe out nicely, and then bend forward. First, put your hands on the floor, slide very nicely, hold your toes with your hands. Now again, breathe in and breathe out and relax. So this is the Ugrasana posture. This kind of posture is again stretching the muscles kind of posture. Now next part is Utkatasana and Malasana. Both exercises are helpful for the lower body muscles. So first we see the Malasana, and after that we see the Utkatasana. After Utkatasana, sitting posture asanas are done, and after that lying posture asanas are started. So first is now Malasana. For Malasana, you should sit like this, join your hands like this, and straight your back as per your capacity. This is called as a Malasana, and it is very helpful in the PCOD conditions also, constipation conditions also. If you are having any gas trouble or gaseous distensions, in that case also you can perform this asana very nicely. So this is Malasana, and which is helpful in the menses cycle problems. Now next part is the Utkatasana. For Utkatasana, again we come to the sitting posture. Whenever you perform the asana, you have to come the primary posture of the asana, that is either sitting posture, standing posture, or lying down posture. Because of this, your joints or muscles are not get fatigued, and you can perform asana very nicely, and you can hold the asana also very nicely. Now next part is our Utkatasana. For Utkatasana, with the help of hand support, you have to sit like this. Hands should be on your knee joints. If you are not having if you are not going to balance in this condition, just put your hands on your yoga mat and you can sit like this also. If you can balance, then your hand should be on your knee joints and hold as per your capacity. This is called as a Utkatasana. Then you want to release the asana, hand should be on your yoga mat, and slowly knee joint should be on your yoga mat and relax. Legs should be straight. So all these asanas are helpful in PCOD and PCOS condition. So as I have explained earlier, if you are not habitual, or if you are not habitual any type of exercise, then start with holding with 5 seconds, then increase the holding capacity 5 seconds and up to the 1 minute, that is 60 seconds. then only you can see the results in your body. Okay, but you should not strain or you should not fatigue your muscles during the practices, which is very important. Now next part is the lying down posture. So for lying down posture, first lie on the yoga mat. Your hands placed near your thighs. First asana is the Uttan Padasana. Now breathe in and lift your both legs 90 degree up to the 90 degree and hold it as per your capacity. Breathe in, breathe out, and breathe in and lift your both legs. If you are not able to, if you can't lift your legs, then you can support your legs with your hands and again lift them. Lift around the 90-degree angle. This is Uttana Padasana. Hold it for 1 minute or as per your capacity and then relax with breathe out. This is Uttana Padasana. Next asana is the Shalabhasana. Lie on your abdomen. It is called as a Viparita Shayana Sthiti. Hands near your thighs. Next asana is the Shalabhasana. It is very important asana when you are having irregular menses along with the back pain. Shalabhasana is very helpful. Now breathe in, breathe out and lift your hand, legs and neck. Hold it as per your capacity or up to the 1 minute and relax. Now third asana is the Pavana Muktasana. For Pavana Muktasana, Shayana Sthiti or lying down posture, lie on your back. Breathe in and lift your both legs. Breathe out and fold your legs near knee joint. Hold your legs with your both hands. Forehead towards the knee joint. Pavana Muktasana. When you hold the posture, final posture, you have to keep breathing or normal breathing should be present. You should not hold your breath. After holding as per your capacity, release the asana from Uttan Padasana to Shayana Sthiti or lying on the back. Next asana is the Bhujangasana. The Pavana Muktasana is helpful when you are having gaseous extensions, when you are having Kati Vedana or lumbar pain. Pavana Muktasana is very helpful. Next asana Bhujangasana. For this, place your both hands near your chest. Breathe in, breathe out and lift your upper body. As per your capacity, hold the asana. Bhujangasana is very helpful in thyroid conditions, maintaining hormonal balance, and also for double chin and also for back problems. These problems are commonly seen in PCOD conditions. Next asana is the Naukasana. Lie on your back. Hands should be near your thighs. Breathe in and lift your both legs. And that is Uttana Padasana. Hold the legs and do the posture like this. Shape of the body is like boat. That's why it is called as a Naukasana. It gives pressure on your lower abdomen. When you get comfortable, then release your hands and hold the posture as per your capacity and relax. So put your legs first down and after that upper body and relax. This posture is very helpful to massage the lower abdominal muscles, and that's why the irregularity of the menses. In the case of irregular menses, Naukasana is very helpful. So next asana, after Naukasana, we are going to perform Dhanurasana and Chakrasana. Dhanurasana, Chakrasana, as the asanas are tricky asanas or difficult to perform type of postures. So if you are performing regularly, then you perform with me no problem. If you are not performing regularly, then properly see the asana posture and after that you can perform. Dhanurasana, Chakrasana are the asanas which gives tremendous stretching effect on your uterine and thighs muscles. And both asanas are very important for the ovarian secretions or ovarian hormonal secretions and estrogen axis balancing. That's why both asanas are very important when we see the PCOD patients. So first is the Dhanurasana. So lie on your abdomen. Take distance between the legs. Fold the legs. Hold the ankle joint with your hands. Breathe in, breathe out, and lift your legs and hands. Hold it as per your capacity. When you get fatigued or when you get stressed out, then relax the asana. If you are having PCOD and if you are having depression kind of symptoms, the Dhanurasana is very helpful. It is not easy asana. If you are performing regularly, then you know that it is not the very easy asana. But for depression conditions, it is very helpful. For hormonal imbalancing, as I have explained earlier, it is very helpful. For feminism, for balancing the feminism, this asanas is very important. That's why it is called as a Saundarya asana. That is beautiful asana. It is also called as a. Next part is the Chakrasana. For Chakrasana, lie on your back. Fold your both legs. Put your hands near your ears or near your shoulders like this. Breathe in, breathe out, and lift your middle body part as per your capacity. And hold the position. This is called as the Chakrasana. After lifting the middle body part, your breathing should be normal. Don't hold your breathing. This is called as a Chakrasana. After that, put your head first down, then middle body part, and relax. Your legs should be straight. Okay. Now next asana are the Sarvangasana, Halasana, and Matsyasana. These asana, Sarvangasana, Halasana, Matsyasana asana, are helpful for thyroid condition. In PCOD and PCOS, hypothyroidism or normal secretions of the thyroxine hormones get decreased. That's why hypothyroidism conditions see. In this condition, Anulom Vilom Pranayam along with Sarvangasana, Halasana, and Matsyasana combination asana is very helpful for treating the thyroid conditions. My one clinical research paper is also published on this. Now we are going to perform the Sarvangasana, Halasana, Matsyasana, and after that we will see the pranayama practices. Okay, so first lie down on your back. Your hands should be near your thighs. Because of this, your body gets specific alignments and you get ready to perform the specific postures. So we are going to perform first asana, that is the Sarvangasana. Inhale and lift your both legs nicely. Now exhale. You have to lift your both legs from your hip joint with the help of hand support. This is Sarvangasana. Next is the Halasana. Your legs towards your head and should be like this. You can hold your legs with your hand also, or you can put your hands like this. This is Halasana. And the last is the Matsyasana. For this, you have to come first in the Uttan Padasana, then Padmasana, and next part is you have to make curvature like this. Hold your hands, hold your legs with your hands and maintain this posture. It is called as a Matsyasana or a fish pose. By relaxing or releasing the asana, first give hand support towards your neck area and slowly relax or release your Padmasana and come back towards the sitting posture. So these are the combination of the asana which are helpful for the thyroid conditions. So we have seen the few asana that are helpful in conditions like PCOD and PCOS. But see, sometimes we don't recognize that this is PCOD condition or this is the PCOS conditions. Lack of investigations or lack of maybe health awareness, that we put our health secondary before our family health. Because of this, if you practice this asana, if you are not having any type of menstrually regulated problem and all, in that condition also, in regular practices of this asana will definitely give you benefits in your overall health. All these asana which I have shown here are helpful in the balancing your hormones, helpful in the balancing your pituitary adrenal axis, which is important for the normal hormone secretions. Now, next part is the pranayama part. For this, I will start the presentation again. So this is the pranayama part. See, the pranayama is very important when we see any psychosomatic type of disorder. Kapalabhati, Agnisar Kriya are type of Shuddhi Kriya. They are not the pranayam, but we can include them in pranayama also because they help to cleanse our respiratory passage and our respiratory and abdominal muscles. Next part is the Nadi Shodhan Kriya. After that, Anulom Vilom Kriya. Next is the Bhrastrika and Brahmari Kriya. So we will start this pranayama part from the Kapalbhati session, and in that picture, the practices of the pranayama, how they help in our body. Pingla Nadi, Sushumna Nadi, and Ila Nadi are the basic or the prime nadis in our body. The purification of these nadis can be done with the help of pranayama techniques. or the breathing techniques. And the activation of the chakras after the purification of the nadis takes place, and which helps in the balancing, or which helps in the maintaining our health very nicely actually. So now first we will see with the Kapalabhati Kriya. What is the Kapalabhati Kriya? So for this session also, I request, if you are not familiar all with this pranayama technique or breathing technique, then please first listen to the information, and under the teacher guidance only you can perform the this kriya. Kapalabhati and Agnisar Kriya are related to our abdominal muscles only. And this in this kriya, that is in Kapalabhati Kriya, we inhalation and exhalation in the inhalation and exhalation procedure or a breathe out procedure is very important. Inhalation or breathe in procedure is very passive. The procedure of breathe in or taking the air inside our body is very passive secondary, but the exhalation procedure or excreting our air from our nostril is very prime or primary portion. So how we going to do this? First, sit in the comfortable posture. Siddhasana is very important in the Kapalabhati. If you are not able to do Siddhasana, then do the sitting posture as per your comfort. If you are not able to sit like this, then you can sit on the chair, you on the sofa also, and you can perform Kapalabhati also. No problem. Then straight your back muscles. Your hands should be on your knee joints. Breathe in and breathe out nicely, and after that, for forceful breathe out or forceful exhalation should be done. And breathe in procedure should be very passive or involuntary. I can say that. So firstly I show you how the Kapalabhati should be performed. During exhalation, you have to contract your abdominal muscles, and during inhalation, they get relaxed automatically. Again, during exhalation, you have to contract your abdominal muscles and breathe out. And again, inhalation, it get relaxed automatically. They get relaxed automatically. The Kapalbhati count of how much Kapalbhati one should perform. Kapalbhati pranayam, if you practicing regularly, then practice up to the 100 counts. In today's practices, many people practices for the 500 count, for the more than 500, 700 count, but it is not required for our body. When we stop the practices of the Kapalbhati, then the reverse effect seen in our body. So, according to researches and according to my experiences also, perform Kapalbhati up to the 100 count if you are practicing regularly. If you are not practicing regularly, you are seeing the Kapalbhati first time, then practices for only 10 counts, take a pause, 10 counts and relax. And you can increase the counts gradually. Okay. So Kapalbhati, in the procedure, the abdominal muscles get contracted and get relaxed. And this gives massage to our soft organs in our body. PCOD condition and PCOS condition. The PCOS condition is not related to only uterus or the ovary. It's related to our metabolic organ system. That's why in PCOS, the Shuddhikriya, this Kapalbhati and Agnisar are very helpful because they massage our soft organ which are important in the metabolic activity of the body. So this is now, next part is the Agnisar Kriya. In Agnisar Kriya, we have to take breathe in then breathe out, close the nostril with your thumb and first two fingers, and after that you have to start contraction and relaxation of the abdominal muscles. Okay, I will show you the Agnisar Kriya. First, breathe in and relax. In this Agnisar Kriya, again the massage or the pressure is generated on the gut or the gastrointestinal system or soft organs, and that's why the blood circulation in the area gets activated and their physiological functions become normal. So Agnisar and Kapalbhati Kriya are important when we see purification, when we want broad blood circulation activation in the area, in the lower abdominal area. Okay. Now next part is the Nadi Shodhan Kriya. Just put one finger or the first finger before your nostril like this. Breathe in and breathe out and see which nostril is activated. The more air come from the nostril, uh, that nostril is activated. If you are having right air, right nostril air more, then it is activated. If it is from the left side, then it is activated, and same air or the balanced air exhalation from the both nostril, then both nostrils are very clean nostrils and you are ready to perform the breathing technique or the pranayama. So first put your finger before your nostril, breathe in and this is the technique to see the nadi shodhan is done in our body or not. If it is not done, then you have to first start with the nadi shodhan. What is nadi shodhan? First, close your right nostril, breathe in and breathe out from the left nostril for the 10 to 15 times. Again, close the left nostril, breathe in and breathe out from the right nostril. Always start from the left nostril. Okay. The Nadi Shodhan is effective for Nadi Shodhana, Ida Pingla Nadi Shodhana, and also it is important in the blood purification purposes also. When we start this type of technique, Nadi Shodhan technique, the blood purification is started and which will give result in normal physiological functioning of the body. So, what is Nadi Shodhan? Close your right nostril 10 to 15 times. Close left nostril 10 to 15 times. Now next part is the Anulom Vilam. Because of the time duration limitations, I am taking this part in very brief manner. Pranayama is a very huge topic. My entire PhD thesis is on the basis of the pranayama techniques only. So it is, but we are having now very limited time. That's why I am taking these concepts in very brief and for related to only PCOD. Now, next part is the Anulom Vilom. As I have stated earlier, in thyroid condition, if you are having the hypothyroidism condition or any type of hormonal imbalancing in male body or in female body also, Anulom Vilom is very effective. What is Anulom Vilom? Close your right nostril, breathe in from left nostril. Breathe out from right nostril. Again, breathe in from right nostril. Breathe out from left nostril. This is called as a circle or chakra, and this the whole technique is called as a Anulom Vilom. Breath holding is very important in Anulom Vilom, which create intermittent hypoxic condition in our body, which is very helpful for the organ functioning or for the pituitary adrenal axis generation, which we give results in the hormonal imbalancing. Now, next part is the Bhrasrika and the Brahmari. In Bhrasrika, what we are going to do? Hands up, breathe in, hands down, breathe out. Breathing and breathe out procedures are forceful procedures. We are not going to perform it slowly. We are going to perform it very forcefully. This is called as a Bhrasrika Pranayam. Bhrasrika Pranayam count should be 20 counts, 40 counts, 60 and 80. In this manner, we can perform Bhrasrika. Bhrasrika Pranayam increases or generates heat in our body, which is helpful in amenorrheic condition, where bleeding is very less, scanty or spotting, maybe we can say. In this condition, Bhrasrika Pranayam is very helpful. If you are having digestion problem, in this condition also Bhrasrika is very helpful. And last part is the Brahmari. Brahmari pranayam is very important for mind health or psychological health. It generates positive energy in our body. And if you are not familiar with yoga and all, then also you can perform the Brahmari pranayama. It is very easy. If you are performing it with me, then I request you all to perform the Brahmari pranayam. We are going to perform it in sitting posture only. Sit on your mat or on the floor as per your comfort zone. Your thumb should be in your ear, and your forefinger should be index finger on your eyebrow, middle finger on your eyes, and the last finger or the ring finger near your nose, and the last finger near your lips. Now breathe in and breathe out. While breathe out, B sound or sound should be present, which is called, or the procedure is called as a Brahmari Pranayam. Brahmara means bee. Brahmara is a Sanskrit word, which is the meaning of the it is bee. Now start with me breathing. And relax. You can perform Brahmari Pranayam up to 10 times. And after 10 times, you just relax, put your hands put your hands on your eyes, and after that, your hand should be joint like this, and just feel the vibration in your body. After joining this hand, just feel the vibrations in your body. Okay, and the Brahmari Pranayam, as I have mentioned earlier, is helpful in the psychological health. Okay, so collectively we see the asana pranayama which are helpful in the PCOD conditions, and how they work is also seen in the presentations. And the last part is the meditation and the relaxation. Meditation and the types of meditation techniques are there. Many types of meditation techniques are there which are helpful in maintaining our psychological health or balancing our psychological and physical balance. And after performing any type of exercise or asana, you should perform the meditation for few minutes, which will give you very positive effect or positive energy is generated in your body. And last, I thank you all of you for listening my lecture, and I thank you Sewa International Europe organization for giving me opportunity to present myself, and I thank you all of you again organizing team for giving me opportunity. And if you are having any query, you can ask me. I stop my presentation here.
Thank you, Mrunalji. It was very informative. Like I couldn't perform all the asanas, but I joined you in the pranayam and I already feel refreshed. Even though with not all the conditions I have, but at least I could perform pranayam with you. And it was wonderful. So thank you again for your presentation and all the demonstrations what you did. I hope even all the participants who join us, they try to do with us. Before going forward now, because of the time restriction, I just ask you one question, which was asked in the chat. So the question is, can you mention which asana is important for reducing pain during menstruation?
Yes, thank you, Mitali, for the questions. Uh, which asana is important for the reducing pain in the menstruation is the question. Uh, in the presentation also, I have mentioned this part. If you are having um, less flow or less menstrual flow, then you can perform certain type of asana which are helpful to reduce the pain. In this type of patient, you can perform Paschimottanasana. But if you are having excessive flow which is more than the normal flow, blood flow is more than the normal blood flow. In that case, don't perform any posture in menstrual cycle. Perform yogasana daily at the end of the fourth or fifth day and up to the next cycle. Perform daily these asanas, and in that condition, Mandukasana, Malasana, and the Paschimottanasana are the important asana. If you are having excessive flow, practice asana after the menstrual cycle. If you are having less flow and pain, then practice Paschimottanasana and Malasana during menstrual cycle, which will give benefits definitely. Okay, thank you.
Thank you, Mrunalji. And also just a last question. So there was asked, can you suggest few asanas to reduce back pain? So I hope the back pain is related to the menstrual cycles. So if we are having back pain during the menstrual.
Yes. If you are having back pain in menstrual cycle, then you should perform Shalabhasan and Bhujangasan, which are very helpful for the back muscle releasing. I'm not saying here relaxing, I'm saying releasing. Our back muscles are wing-like structure and it is very compact structure. When we perform Shalabhasan and Bhujangasana, the compact muscle get released like this. The muscle posture is like this, and when we perform the asana, they get released like this, wing-like structure, and that's why back pain get reduced. Thank you.
Thank you, Mrunalji. So if anybody of you have any more question, please also feel free to write it over our email. Uh, and just before concluding, thank you again all for joining in today. If you want to know more about the Seva activities, you can also visit sevaeurope.org for more information, or you can also write us an email at info@sevaeurope.org. So thank you again, Mrunalji, for joining in today, and also thank you for all the attendees who attended today. If you also wish to volunteer with us for Seva, you can also find it at our website as well. Thank you. So before we just end, I request all, we just fold our hands, we'll say a Shanti Path. Please close your eyes and fold your hands in Namaskar. Breathe in and breathe out, relax. सर्वेऽपि सुखिनः सन्तु सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात् ॐ शान्ति शान्ति शान्तिः. Thank you again.
The webinar has ended. Thank you for joining. Goodbye.